Cardiovascular disease is a general term used to describe a variety of diseases that affect the cardiovascular system, which consists of the heart and the network of blood vessels that circulate blood throughout the body. Examples of these diseases include coronary heart disease, heart attacks, faulty heart valves, and heart failure. The goal of this explanation is to briefly outline these conditions and then focus primarily on the treatments available to manage or cure them, which include medical and surgical options such as stents, statins, replacement heart valves, and even full heart transplants. Let's start with coronary heart disease, which occurs when the coronary arteries, the vessels responsible for supplying oxygen-rich blood to the heart muscle itself, become partially blocked due to the buildup of fatty deposits along their inner walls. This buildup gradually narrows the lumen, or the internal diameter, of the arteries, which means that less blood and consequently less oxygen can reach the heart tissues. Since the heart is a muscle that works continuously and requires a constant and high supply of oxygen, this reduced blood flow can place the heart under significant strain and may ultimately lead to a heart attack. Two major treatments used to manage coronary heart disease are stents and statins. A stent is a small mesh-like tube that can be inserted into the narrowed artery, where it expands and holds the artery open, allowing blood to flow more freely. The benefits of using stents include a relatively short surgical procedure and long-term effectiveness in maintaining blood flow. However, as with any surgical intervention, there are risks involved, such as the possibility of heart attack during the procedure, post-operative infection, or the development of a blood clot near the stent, a condition medically referred to as thrombosis. On the other hand, statins are a type of medication designed to regulate the balance of cholesterol in the blood. Cholesterol is a form of lipid that is essential for our body, but it exists in two main types: the bad kind known as low-density lipoprotein, or LDL, and the good kind known as high-density lipoprotein, or HDL. Unfortunately, most people have too much of the bad LDL cholesterol, which contributes to the formation of fatty plaques in the arteries, and too little of the good HDL cholesterol, which helps clear away those deposits. Statins are effective because they lower the levels of LDL cholesterol and increase the levels of HDL cholesterol, which not only reduces the risk of coronary heart disease, but also lowers the chance of suffering from strokes and other cardiovascular events. However, the use of statins comes with its own set of challenges. The medication must be taken consistently over many years, and some individuals may experience side effects such as persistent headaches or even kidney damage, making it important for doctors to monitor patients regularly. Another issue that can affect heart function is damage or weakening of the heart valves. These valves are essential in ensuring that blood flows in only one direction through the heart's chambers. Valves can become faulty either through aging, where natural wear and tear occurs over time, or as a result of other complications such as heart infections or past heart attacks. When valves become stiff and do not open fully, or when they fail to close properly and allow blood to leak backward, this disrupts normal blood circulation and places added pressure on the heart. Faulty valves can be treated by replacing them, and these replacement valves can be either biological, made from animal tissue such as that of pigs or cows, or mechanical, made from synthetic materials. Regardless of the type, valve replacement requires surgery and carries risks, including the possibility of blood clot formation around the new valve. If heart function becomes severely impaired and the heart can no longer pump blood effectively around the body, a person may be diagnosed with heart failure. At this advanced stage, medications can provide some relief, but the only definitive treatment is to replace the failing heart. Similar to valve replacements, hearts can be replaced with biological hearts from human donors or artificial hearts made from synthetic materials. However, artificial hearts have limitations and are generally used as a temporary measure until a real donor heart becomes available. Unfortunately, biological heart donations are scarce because we cannot use animal hearts and must rely on donations from recently deceased human donors. The waiting time for a suitable donor heart can be very long, and even after a successful transplant, the recipient's immune system may recognize the new heart as foreign and attempt to destroy it, a process known as organ rejection. One of the few advantages of artificial hearts is that they are made from metals and plastic, so they are not attacked by the immune system in the same way. In some cases where both the heart and lungs are diseased, a heart and lung transplant may be necessary. However, finding both organs from the same donor and coordinating the complex surgery involved is extremely difficult and resource-intensive. Overall, although cardiovascular diseases can be serious and life-threatening, advances in medical technology, pharmaceutical development, and surgical techniques have made a range of effective treatments available that significantly improve quality of life and survival rates for many patients.